Salam sejahtera, nama saya Vivi Absingtong dari kelas Pkuk 2. Hari ini saya akan membentangkan tajuk berkaitan kehilangan pendengaran yang merangkumi jenis dan darjah, cara mengukur tahap, pemilihan alat bantu yang efektif serta cadangan rawatan atau terapi yang bersesuaian. Topik ini amat penting kerana kehilangan pendengaran boleh memberi kesan yang besar terhadap komunikasi, pembelajaran dan kualiti hidup seseorang murid. Sebelum saya mula pembentangan saya pada hari ini, jom kita tengok satu video dulu.
Nearly 50 million people in the United States have some form of hearing loss. And by 2060, that number is expected to climb to nearly 75 million. At present, 2/3 of people over the age of 70 have hearing loss. The fact of the matter is that at one point or another, hearing loss touches everyone's lives, whether it's your hearing loss or a family member's. That's why today I'll be reviewing the 3 types of hearing loss, including their main causes, if it can be prevented, and treatment options. But before we do that, we would really appreciate if you could give this video a thumbs up to bring videos like these to a wider audience. And while you're at it, if you haven't yet already, hit that subscribe button with notification bell. Make sure you do that too so that you never miss any one of our newly released videos. Now, to understand each type of hearing loss, you first need a foundational understanding of ear anatomy. The human ear is actually composed of 3 distinct elements: the outer ear, the middle ear, and the inner ear. The outer ear includes your pinna, which is what most people think of when they hear the word ear, as well as your ear canal and eardrum. The purpose of the outer ear is to pick up sound vibrations and funnel them down to your eardrum, where they are then transferred to the middle ear. The middle ear happens to consist of the 3 smallest bones in your body known as the ossicles, which include the malleus, incus, and stapes. In both the outer and middle ear, sound vibrations are amplified and turned into mechanical pulses that are then sent to the inner ear. The inner ear is comprised of the cochlea, which is your hearing organ, the semicircular canals, which control balance, and the auditory nerve. Inside of the cochlea, there's a bunch of fluid and a membrane, with 3 rows of outer hair cells and a single row of inner hair cells. The outer hair cells are responsible for enhancing these vibrations even more, and the inner hair cells are responsible for receiving these vibrations. Once received, the inner hair cells turn these vibrations into neural impulses that travel up the auditory nerve to your brain. As you can tell, this system is very complex, and any issues along this pathway can lead to hearing loss. But it is the location of these issues that will determine which type of hearing loss you have. First, let's talk about sensory neural hearing loss, which is the most common type, accounting for nearly 90% of all hearing losses. This is when the sensory or nerve portion of your hearing is affected, including the structures within the cochlea or your auditory nerve. More often than not, this type of hearing loss is caused by damage to the tiny inner and outer hair cells within the cochlea. Although the outer and middle ear may be doing their job just fine, the inner ear is unable to receive or transmit the vibration of sound up to the brain effectively. But what causes these hair cells to become damaged in the first place? The most common causes of sensory neural hearing loss include loud noise exposure, age, and genetics. Noise-induced hearing loss is caused by exposure to loud sounds. This can include high-intensity sounds that don't occur for very long, including gunfire, explosions, and even power tools. Noise-induced hearing loss can also occur with more sustained loud noises, such as motorcycles, concerts, and heavy equipment. Whether it's caused by a one-time incident or over years of exposure, loud noises can cause serious damage to the cells in the hearing organ, resulting in permanent hearing loss. Fortunately, this is the only cause of hearing loss that is entirely preventable so long as you know your risk and use proper hearing protection. Another common cause of sensory neural hearing loss is aging. This is a pretty unavoidable source of hearing loss that is growing in prevalence as people are living longer and longer, which leads to the natural inner and outer hair cell deterioration. With age comes the development of other health issues that could accelerate the deterioration of these hair cells, including diabetes, high blood pressure, and kidney disease. While you can't avoid age-related hearing loss entirely, it's important to minimize your risk of developing any of these other health conditions that could impact your hearing. In general, this involves leading a healthy lifestyle, monitoring any current conditions you may already have, and following your doctor's treatment recommendations. Lastly, genetics play a huge role in whether you will develop hearing loss, including when and how rapidly. Nearly 60% of cases of children born with hearing loss are due to genetic factors, making it impossible to avoid. While noise exposure, aging, and genetics are the most common causes of sensorineural hearing loss, there are numerous less common causes. For example, sudden sensorineural hearing loss is the rapid development of significant hearing loss, generally in one ear. This condition often occurs instantaneously, and researchers are still stumped as to why it happens, though there is a strong theory that it is due to a viral attack of the inner ear. Often disguising itself as an ear plugged with earwax, this type of hearing loss should be assessed immediately by a hearing healthcare professional, because it often requires medical intervention that is time-sensitive in order to recover your hearing. Sensorineural hearing loss is diagnosed through a hearing evaluation, with responses plotted on an audiogram. On this graph, the X's and O's indicate your left and right ear responses to tones when sound passes through all three parts of the ear. The brackets indicate when sound is picked up by the cochlea directly. If the X's and O's line up with the brackets and they fall into the mild hearing loss range or worse, this is characterized as sensorineural hearing loss. Although the exact pattern of hearing loss is different from person to person, there are some clues in an audiogram that can point to specific causes. For example, noise-induced hearing loss generally has some form of a noise notch near 3000 Hz. Age-related hearing losses first develop in the high pitches, resulting in a characteristic downward slope through the high frequencies. Genetic hearing loss patterns depend on the genetic mutation itself, but a common pattern is a cookie bite hearing loss, with hearing loss occurring mostly in the mid-pitches. With all the different causes and presentations, you may be wondering if anything can be done to treat this hearing loss. Luckily, the majority of sensorineural hearing losses can be successfully treated through the use of properly programmed hearing aids. In some cases of severe to profound hearing loss, cochlear implants may be required for successful treatment. Now, let's move on to the second type of hearing loss, conductive hearing loss. Conductive hearing loss accounts for somewhere between 5 to 15% of hearing losses, and it occurs when the vibration of sound cannot make it from your outer ear to your inner ear. As you'll recall, sound vibrations must travel through the outer ear and the middle ear before they can make it to the cochlea. If there is a blockage or physical issues impacting the function of this pathway, sound vibrations cannot turn into electrical impulses that travel up to the brain. In the outer ear, sound vibrations can be blocked by earwax buildup or outer ear infections. Many conductive hearing losses are also caused by issues with the eardrum, including perforations or buildup of scar tissue from chronic outer ear infections. In the middle ear space, infections, disconnected or fused ossicles, and even issues equalizing middle ear pressure can lead to conductive hearing loss. Certain conductive hearing losses are preventable. For example, if excessive earwax is causing hearing loss, you can schedule regular professional earwax removal appointments or attempt at-home earwax removal. Additionally, you don't have to worry about poking a hole through your eardrum, causing a conductive hearing loss if you're not sticking anything in your ear canal, like car keys, bobby pins, or cotton swabs. During a hearing test, a hearing healthcare professional will be able to easily identify a conductive hearing loss by spotting something called an air-bone gap. This is when there is a gap between the X's and O's and the brackets on your audiogram, but the brackets still remain in the normal hearing range. These gaps demonstrate the difference in responses when the whole auditory system is being tested with the X's and the O's versus the responses when just the hearing organ is being tested with the brackets. Fortunately, conductive hearing loss can be treated through the use of medication, in-office procedures, or surgery once the cause of the conductive hearing loss has been identified. Oftentimes, this gap can be eliminated, returning the X's and O's back to the level of the brackets that are in the normal range. But depending on the person and the problem, treatment may include the use of hearing technology, including hearing aids, bone-anchored hearing aids, and even middle ear implants such as Sound Bridge. The third and least common type of hearing loss is mixed hearing loss that includes components of both sensorineural and conductive hearing loss. For example, someone with mixed hearing loss may have sensorineural hearing loss from years of unprotected target shooting, and they may have conductive hearing loss from accidentally sending a cotton swab through their eardrum. You can see from this example audiogram that there are noticeable air-bone gaps, which indicates some level of conductive hearing loss. But neither the X's and O's nor the brackets fall within the normal range, indicating that this hearing loss is caused by both the conductive pathway of the outer and middle ear and the sensory neural portion of the inner ear. Mixed hearing loss generally requires a care team that includes an ear, nose, and throat physician for the medical management of the conductive component of the mixed hearing loss, and an audiologist to treat any remaining sensory neural portion of the mixed hearing loss. Research has now consistently identified that untreated hearing loss is the single largest potentially modifiable risk factor for developing dementia, not to mention the negative impacts that hearing loss can have on communication, work, relationships, depression, and social isolation. For this reason, it's important that you have your hearing tested if you, any of your family members, or your medical providers express any concerns, or once you're over the age of 50.
Kehilangan pendengaran merupakan satu keadaan yang boleh menjejaskan keupayaan seseorang individu untuk berkomunikasi dan berinteraksi dengan persekitaran sekeliling. Dalam konteks pendidikan, murid yang mengalami kehilangan pendengaran memerlukan perhatian dan sokongan khusus agar mereka tidak terjejer dalam pembelajaran. Oleh itu, ia adalah penting untuk memahami jenis dan darjah kehilangan pendengaran, cara mengukurnya, pemilihan alat bantu pendengaran yang sesuai, serta rawatan atau terapi yang bersesuaian. Macam tadi saya cakap. Dari segi jenis kehilangan pendengaran, terhadap 3 kategori utama. Salah satu kehilangan pendengaran konduktif macam ni berlaku apabila bunyi tidak dapat dihantar dengan baik melalui telinga luar atau telinga tengah. Contohnya akibat jangkitan telinga atau saluran telinga tersumbat. Selepas itu, kehilangan pendengaran sensori neural macam ni. Dia pula disebabkan oleh kerosakan pada telinga dalam atau saraf pendengaran dan biasanya bersifat kekal. Manakala yang ketiga ialah kehilangan pendengaran campuran, ialah gabungan kedua-dua jenis tersebut. Selain itu, kehilangan pendengaran juga diklasifikasikan mengikut darjah, iaitu ringan, sederhana dan teruk hingga sangat teruk. Macam ni. Darjah kehilangan ini menentukan sejauh mana seseorang individu mampu mendengar bunyi dan memahami pertuturan seharian. Untuk mengukur sejauh mana kehilangan pendengaran, ujian audiometri dijalankan dan keputusan dipaparkan dalam bentuk audiogram. Jom kita tengok movie untuk lebih memahami audiogram.
Hi, this is Tom from ZeroToFinals.com. In this video, I'm going to be going through audiometry. And you can find written notes on this topic at ZeroToFinals.com/audiometry or in the ear, nose and throat section of the Zero to Finals surgery book. So let's jump straight in. Audiometry involves objectively testing a patient's hearing by playing a variety of tones and volumes. Air conduction is tested by using headphones, and bone conduction is tested using a device called an oscillator that delivers sounds directly to the bones of the skull. Audiometry results are recorded on an audiogram. Audiograms can help identify and differentiate between conductive and sensory neural hearing loss, and we're going to talk in more detail about how this is done. Let's talk about audiograms. Audiograms are charts that document the volume at which patients can hear different tones. The tone is measured as frequency in hertz, which is plotted on the x-axis, from low to high-pitched. The volume is measured in decibels, which is plotted on the y-axis, from loud at the bottom to quiet at the top. The lower down the chart, the higher the decibels and the louder the volume. The higher up the y-axis, the more sensitive the patient's hearing is. Hearing is tested to establish the quietest volume at which a patient can hear each frequency. This level is plotted on the chart. The louder the sound required for the patient to hear, the worse their hearing is, and the lower on the chart they will plot. For example, 1,000 Hz sound will be played at various volumes until the patient can just about hear the sound. If this tone is heard at 15 decibels, a mark is made on the chart where 1000 Hz meets 15 decibels. If this sound can only be heard at 80 decibels, a mark is made where 1000 Hz meets 80 decibels. Hearing is tested in both ears separately. Both air and bone conduction are tested independently. The following symbols are used to mark each of these separate measurements. X is used to mark the left-sided air conduction. A square-shaped closed bracket is used to mark left-sided bone conduction. An O is used to mark right-sided air conduction. And a square-shaped open bracket symbol is used to mark right-sided bone conduction. When a patient has normal hearing, all readings will be between 0 and 20 decibels at the top of the chart. In patients with sensorineural hearing loss, both the air and bone conduction readings will be more than 20 decibels, plotted below the 20 decibel line on the chart. This may affect only one side more than the other, or both sides equally. In patients with conductive hearing loss, bone conduction readings will be normal, between 0 and 20 decibels. However, air conduction readings will be greater than 20 decibels, plotted below the 20 decibel line on the chart. In conductive hearing loss, sound can travel through the bone, but is not conducted through air due to pathology along the route into the ear. Both air and bone conduction readings will be more than 20 decibels in patients with mixed hearing loss. However, there will be a difference of more than 15 decibels between the two, with bone conduction better than air conduction, plotted slightly higher on the chart.
Audiogram ini menunjukkan tahap pendengaran individu berdasarkan frekuensi bunyi dan kekuatan bunyi dalam unit tersebut. Melalui audiogram ini, pakar audiologi dapat mengenal pasti tahap serta jenis kehilangan pendengaran yang dialami. Penilaian ini sangat penting kerana ia menjadi asas kepada perancangan intervensi sama ada dalam bentuk alat bantu pendengaran, terapi atau sokongan pendidikan. Tadi saya bincangkan tentang proses diagnosis, bahawa sekarang saya akan masuk pemilihan alat bantu pendengaran. Dalam aspek ini, beberapa faktor perlu dipertimbangkan seperti jenis dan darjah kehilangan pendengaran, umur individu serta keperluan komunikasi mereka. Antara alat bantu pendengaran yang biasa digunakan ialah alat bantu pendengaran digital macam ni, alat bantu pendengaran belakang telinga kat sini, dan implant cochlear macam ni. Bagi kes yang kehilangan pendengaran yang teruk, pemilihan alat bantu pendengaran yang sesuai dapat membantu individu mendengar dengan lebih jelas. Seterusnya, meningkatkan keupayaan berkomunikasi dan keyakinan diri mereka. Selain penggunaan alat bantu pendengaran, rawatan dan terapi yang bersesuaian juga memainkan peranan penting. Antaranya ialah terapi pertuturan dan bahasa bagi membantu individu membina kemahiran komunikasi serta latihan pendengaran untuk meningkatkan keupayaan membezakan dan mentafsir bunyi. Di samping itu, sokongan seperti pendidikan penggunaan bahan visual macam ni, teknologi sokongan dan pendekatan pengajaran yang inklusif amat diperlukan, terutamanya dalam kalangan murid perkumpulan khas. Kerjasama antara guru, ibu bapa dan pakar amat penting bagi memastikan pengembangan murid supaya mereka dapat capai secara menyeluruh. Sebelum saya mengakhiri perkongsian saya pada hari ini, melalui tugasan ini, saya menyedari bahawa isu kehilangan pendengaran bukan sahaja melibatkan aspek perubatan, tetapi juga memberi kesan yang besar terhadap perkembangan pembelajaran, emosi dan sosial murid. Sebelum ini, pemahaman saya tentang kehilangan pendengaran agak terhad dan lebih bersifat umum. Namun, setelah mendalami topik ini, saya lebih memahami kepelbagaian jenis dan darjah kehilangan pendengaran serta cabaran-cabaran sebenar yang dihadapi oleh murid kurang upaya pendengaran dan persekitaran pendidikan. Saya juga memperolehi pengetahuan baharu tentang kepentingan ujian autometri dan autogram dalam menentukan tahap kehilangan pendengaran seseorang individu. Melalui pemahaman ini, saya dapat menyadari bahawa penilaian yang tepat sangat penting sebelum sebarang intervensi dijalankan. Tanpa penilaian yang betul, murid mungkin tidak dapat menerima sokongan yang sesuai dengan keperluan sebenar mereka. Hal ini demikian kerana tugasan ini membuka mata saya tentang peranan profesional seperti pakar audiologi dalam menyokong sistem pendidikan khas ini. Selain itu, tugasan ini juga membantu saya memahami bahawa pemilihan alat bantu pendengaran tidak boleh dibuat secara sembarangan. Setiap murid mempunyai keperluan yang berbeza bergantung kepada jenis dan darjah kehilangan pendengaran yang dialami oleh mereka. Oleh itu, alat bantu pendengaran yang sesuai bukan sahaja dapat meningkatkan keupayaan mendengar, malah juga dapat membantu murid membina keyakinan diri dan berkomunikasi dengan lebih berkesan di dalam bilik darjah. Saya juga menyedari bahawa penggunaan alat bantu pendengaran sahaja tidak mencukupi tanpa sokongan rawatan dan terapi yang bersesuaian. Terapi pertuturan, latihan pendengaran serta pendekatan pengajaran yang inklusif amat penting bagi memastikan murid dapat berkembang secara lebih holistik. Hal ini kerana menekankan kepentingan kerjasama antara guru, ibu bapa dan pakar dapat membantu murid kurang upaya pendengaran mencapai potensi maksimum mereka. Baik, sekarang sebagai refleksi ke diri, tugasan ini menyedarkan saya tentang tanggungjawab sebagai seorang guru untuk menjadi lebih peka, prihatin dan bersedia menyesuaikan kaedah pengajaran mengikut keperluan murid. Seorang guru yang cemerlang bukan sahaja menguasai isi kandungan pembelajaran, tetapi juga berperanan sebagai pembimbing yang memahami kepelbagaian keupayaan murid. So, saya berharap ilmu dan kesedaran yang diperolehi melalui tugasan ini dapat diaplikasikan dalam alaman pengajaran pada masa hadapan saya demi untuk mewujudkan persekitaran pembelajaran yang lebih inklusif dan berkesan. Baik, kesimpulannya, pemahami yang jelas tentang kehilangan pendengaran membolehkan guru membuat keputusan yang tepat dalam menyediakan intervensi yang berkesan. Guru cemerlang bukan sahaja menyampaikan ilmu, malah berperanan untuk membantu murid untuk mematapatkan profesion perguruan dengan memastikan setiap murid, termasuk murid kurang upaya pendengaran, supaya mereka dapat peluang itu untuk mendapat pembelajaran yang adil dan bermakna. Itu sahaja pembentangan hari kali ini. Sekian terima kasih.